To get started with this session, I am pleased to introduce Professor Siqian Shen, who is an associate professor of industrial and operations engineering, and she is also an associate director of MICDE. She's an expert on integral programming, stochastic and robust optimization, and network optimization. And since the outset of this pandemic, she has applied her expertise to many of the challenges that have been brought on by the pandemic. And this short talk will only give us a glimpse and an overview of all the work she's done. So please, Siqian, take it over.
Okay, yeah, thank you, Mariana. And thank you everyone for coming to this event, for joining us this morning. So today I would like to share some of our work on using decision-making models for resource allocation and response to future COVID-19 infection uncertainty, and also maybe some other disease outbreaks. So first I will talk about, this is the outline of the talk today. I will have a brief introduction about the background, and then we will talk about specific impacts of COVID-19 pandemic on various kind of like areas. And then I will give a brief description of 3 projects that we did in last year, basically related to COVID-19 problems. So the talk today actually is a snapshot of some of the problems that we gather here. This is a website that we built titled Optimization and Data Analytics Tools for Addressing COVID-19 Related Problems. You can find maybe a lot of other related problems that as I talk today there. And then also you can find some of the decision-making models and solution approaches there, and some data analytical tools there. So this website is still undergoing. So we will, kind of like post our results there as it goes. And I also would like to thank the team who has been putting tremendous effort in the last year into various projects. Some of the PhD students working with me, despite that they have their own thesis to write, they also, getting very interested in some of these COVID-19 related problems, and then they guide through some of them independently. So if I conduct the research, and then also some undergraduate students from various backgrounds working on this research last year. Okay. And also, without all the support and sponsors, we wouldn't be able to conduct research for this long. So I would like to thank, NSF. And actually, we got a recent grant that in particular, kind of by looking at the impacts of COVID-19 in transportation problems, and also, Microsoft AI for Health grants, and as well as all the support from College of Engineering, Department of Logistics, Transportation and Parking at the university, and also MICDE for supporting all the computational resources and all the human resource support. Okay. So when we talk about COVID-19, a lot of things that we can get from data. So I kind of like take some of the examples from the previous presenters, and also expert in School of Public Health at Michigan. They kind of like put a lot of effort, try to visualize what would be the immediate sort of like data and trend that we can get out of COVID-19. For example, you can see, who has been vaccinated, and then using these vaccination dashboard, you can also see the current infection in different areas in Michigan, and so on and so forth. So there's a lot of data that you can get in terms of infection testing and also vaccination, using this data dashboard. And also, one step further, once you have the COVID infection data, you can try to link them to some other data that you observe, right? So one of the example that I show here is the project that we did last summer, which is trying to link the relation between COVID-19 infection and mobility. So you can, if you go to the website I showed you earlier, basically you will see this dashboard dynamically update like changes in mobility in different areas. So you can choose to see county level mobility data in the United States, or, like even at a global level, as far as they have some, kind of like a data report to Google. So this is based on the Google community report that Google collects, and then trying to kind of like relate the mobility data with COVID-19 data. And then, from there, you can even like zoom in to understand for specific travel, say for in Michigan, in Wayne County, for retail, how the mobility changes depending on the COVID-19 infection. level changes. So these kind of like a data trends can be can be studied using data science tools, right? Scientific tools. So, but then, what we like to do is take one step further, which is if you have these data and you kind of like understand the trends, eventually you want to flatten the curve. So how to do it? It involves a lot of decision-making models in epidemic prevention, intervention, and recovery phases. So I will give you a few examples later what these decision-making problems are, but basically what we like to do is taking from data to action to solutions. And then the way to do it is you can build mathematical programming models, and then you can use scientific computing tools to better prepare for future pandemics. And then even you can like customize these models for different regions and communities, okay? So one example is very straightforward, is related to healthcare, resource allocation. Basically, you will have very high demand during very small time period, but then you have very tight resources, right? So this abstract problem is there, that how can you avoid overcrowdedness and also cross-infection by better allocate resources? And then when I mean resource allocation, it can mean a lot of things. So for example, how do you do ICU bed allocation? That's one type of resource you can do. How do you do staff planning? How do you do patient admission control? And how do you do ambulance dispatch? All these are related to the resources that people can dispatch and allocate. And then, we can build models to guide us to do that. So one example is this very recent paper that is published in Operation Research, one of the flagship journals in our area. So basically the authors there talk about how can you do ICU bed allocation using a Markov decision process model. So the idea here is that for Markov decision process model, you will need some description about the states, and you need the actions, right? So in this case, you can imagine that basically the conditions are characterizing the states you have. So different patients has different levels, and then you can divide them into different types. And basically, they will transit from one type to another with certain probability. And that transition depends on your action, whether or not you admit them to the ICU or discharge them. And also, you will have certain capacity in the ICU. And then the question here is how to allocate these capacity and how to admit patients and discharge them when the time comes to minimize the total death toll. So overall, you can build this kind of like a graph. And this graph shows you what a Markov decision process looks like in this particular setting. So this is sort of like something related to my first topic here that we have done in the past year, is to looking at, kind of like a marginalized communities. And so in particular, we're looking at communities that are isolated facilities. So COVID-19 is particularly dangerous in these overcrowded facilities where the social distancing is very hard to impose. And then some of the example you can think about are prisons, right? And then, or nursing homes. And then in these cases, you kind of like have a very isolated space, but then within the space, people are going to evolve to different disease level if you have an outbreak, okay? And then for all the groups involved in these communities, they are highly vulnerable, right? They're because some of the people have pre-existing conditions and things like that. It's very important to actually make some decision to alleviate the risk of infection in these spaces. So one thing that you can do is basically for prisons, right? People have been talking about some early release decisions that people can make. For nursing homes, you can also try to do that. So the idea here is that you can build a Markov decision process, which I showed you earlier. And in this case here, we have some state I, and basically you can take some action. So the action related to early release decisions from certain groups in the facility. So first of all, you will categorize them into different levels of groups, and then you will track their, kind of like which state they are. And then, the decision, release decisions are made at periodical time, and then based on the state of the system. So you'll kind of like keep on tracking the state of the system. And then what's the state of the system? There are some trade-offs, right? Other than the health conditions, there will also be some other things that you take into account, which is, like recidivism risk if it's related to prison. And also, like what's the likelihood that these, resident, if you discharge them, they will end up with a not happy life. So there will be a lot of like things taken into account in addition to the health conditions of these population groups. And then once you have those, you can build some Monte Carlo simulation model to configure the transition probability between, between different states if you're given certain action. So we build this MDP, and then basically this is one snapshot of our results. So, as you can expect it, we will have certain policies, right, given to the decision makers here. So we run this with realistic size prison setting with 400 prisoners. And then the results using the MDP suggest that this is like the overall result is if you want to have like a single policy, basically you can, you will put the most emphasis on the people who has high risk in health, but then low recidivism risk to release. But of course, like depending on what state you have, you will have a sequence of policy that you can implement on the right-hand side. Okay, so the details of the model and also the results are in this paper that we're posting on the website that I showed you before. So this is use multi-criteria Markov decision processes for de-densification of isolated facilities during a pandemic. Okay. So the next one will get a very sort of like impacted by the pandemic is transportation system. And so before I talk about that, actually, I want to bring up this medical home care thing, which seems to be related to healthcare, not directly to transportation, but then, we will take the linkage between the two later. Okay, so as you can imagine, the medical home care becomes more popular because of the pandemic. And not only, from the patient's sort of like preference, but also hospitals would like to let the patients with minor conditions staying home as much as possible, right? But then if you want to do that, basically you need to deliver certified nurses and the supplies to patient homes. So in an earlier study before the pandemic, we study, the possibilities of using medical healthcare in different counties and regions to serve underserved communities. So this is one of the kind of like an example that it can show you. Basically, if you want to do that, you will have a delivery problem. And this is a very traditional problem called vehicle routing and matching problem in the transportation literature, okay? So this is a map I'm showing you that our solution basically use this VRP, vehicle routing, to try to design the regions that will be covered by different hospitals, and how do you kind of like route between these regions using shuttles to deliver medical home care, okay? The other example you can think about will come out from this pandemic are going to be very relevant are these two other things I listed here. So one thing is online grocery shopping. There will be more people demanding groceries online and delivered to their home. And that's a very relevant problem. In fact, the model will be very similar to the medical home care that I just talked about, also using the vehicle routing model, okay? The other thing is that, for example, in AAPS, another public school, because when the kids are not in school, they actually try and make the effort of deliver lunches to household that qualify for free lunch before in school. So, how do you deliver these lunches to individual household becomes another problem that you can use this vehicle routing and matching to. Okay, so for that, we had several papers on the vehicle routing, and then one of the recent ones studying specifically these kind of like setting is the one I listed here. Okay. But then, the vehicle routing has a lot of use. And then one is in the redesign of the campus school bus that we did last year. So if you think about the blue bus system we had before, most of them are very long routes, right? Most of them, actually, some of them will take you 15 minutes going from North Campus to the South Campus. But then because of COVID-19, there's a lot of social distancing requirements and also restrictions in terms of how long each route can be. And then that really motivated our work last year in terms of how can we make the bus system more efficient and using something we call the hub and spoke design. So basically we're going to identify some hubs, and once we have them, we will design a vehicle routing system to connect them. And then that's the work I'm showing you here. I wouldn't get to the technical details, but then as you can see here, once we have the design, we also use simulation to test the system, and then to try to get some user perspective results, like how long the waiting time is and how many times they have to take the transit. So then, we have this new bus system that you are probably using these days. And then for that, basically, we were showing that if even using only 50% capacity, but then because you use this hub and spoke design, you will achieve the same number of riders as before if you use a 100 capacity. We also reduce the bus stops to 50 from 110 before. There will be more than 35% passengers wait less than 1 minute in the system. And actually 70% of passengers still only takes one bus to go from their origin to destination. And then the reduction of some bus capacities will have no impact on the individual passengers waiting time. So the last part, I don't think I have the time to finish. Basically, it just talks about another decision-making model, which we call facility location, to solve and some of these sort of like vaccine distribution, or you can think about testing kit distribution problems. So you can still build this decision-making model. The details are in this paper that we just posted online. And then, like I'm showing you basically, by taking into account the uncertainty, which is how many people are going to take vaccine and so on and so forth, you can build either robust solutions or stochastic solutions, and then they will be achieving different levels of, kind of like quality of service. So with that, I would like to conclude my talk today. Basically, I think the message I want to deliver here is like combining the data models with decision-making models are very necessary when we get to the next step of better plan for future. And then also including the uncertainty, both the supply side and demand side will be very important and necessary as well. And then the scientific computing tools can be used for making the decision-making process more efficient, especially when you try to get the solution at scale. Lastly, a network view is also necessary to understand the spatial temporal correlation between data, decision policy, and user response. Thank you very much for your time, and I would like to take any questions if you have.
Okay, and again, please type any questions in the chat. And just to start with some questions, Siqian, how much have you been able to scale these problems? You talk about like modeling the buses at the on-campus level, but have you tried to scale them up even to?
Yeah, so that's a very good question. It really depends on the specific sort of like models that we're talking about. If you talk about, like, say, vehicle routing models, which I show in the second project, right? So basically, those are very hard problems, which people have been struggling trying to make them at scale if you want to get optimal solutions. But of course, you can design heuristic algorithms. For the bus system, most of the decisions are planning decisions, which means that you don't have to really make them on demand, like a dynamic way. So then, like you can afford, computing a model and take days to get a solution, but then just implement that solution for next year or something, right? So I think, if you talk about like scale that even to a city size, not even another city, but then say larger cities, it's doable. It just like, it would take a lot of computational hours. The harder ones, to make them, kind of like scalable are the ones that you have to do it on demand. Like, like these Uber and Lyft ride sharing services, like you have someone submit a request and then you have to pick them up. So those will be some other related, healthcare or the grocery delivery that I talk about. And so for those, the size that we're looking at is still around, say, at the same time, the system wouldn't have like thousands of users, probably like at the 100 level, then we can sort of like handle it on demand. But it really depends on how you implement the solutions. But the facility location I talk about later, which I didn't get to the detail, that can be scaled quite much as compared to the vehicle routing.
How large is the problem, for example, for the 100 people of delivering groceries? Like,
yeah, so if at the same time there are 100 people in your system that kind of like they may requesting delivery from Whole Food, can you handle all their kind of like requests that within an hour or so? So that's the idea. Yeah.
Thank you very much for the talk, and
thank you for having me.